It gave me the option of getting a defibrillator placed. They say that I'm at great enough risk for a deadly arrhythmia or heart failure that it could be a good option. Hey guys, Temptation here with the Final 10. Coming at you today with a topic that some of you wanted to know about me, and that is what is the heart disease I have? How does it work? How does it affect my daily life? Is it related to cystic fibrosis? And more importantly, is this going to interfere with my chances of transplant? And so I'm going to answer all of those today. And also, you'll see me looking over here to the left. I have my laptop here, and I have some questions and some information written down, some of the medical information that I need to get right. This topic is not going to be the easiest to understand, mostly because, for one, I don't understand. I don't have a full depth or background in cardiac knowledge, so it's all new to me. So just try to follow along with me, and I'll do my best at explaining today. So I'm going to try to make this one short. Marlene and I are going to spend the weekend with her parents, and looking forward to that. So got to get to packing pretty soon. So first question you all ask is, what is it, or what is it called? And so it is non-compaction cardiomyopathy. So what that essentially means is that my heart is not compacted, meaning pushed together into a firm muscle. So the left ventricle specifically is spongy-like. It has these trabeculations, or what they're medically called. And so the blood tries to exit out of the left ventricle, so it squeezes, and some of the blood doesn't come out, which is normal. My left ventricular ejection fraction, meaning the amount of blood that your heart puts out back into your body once it's been oxygenated, is 39%. 39% sounds really awful, but for the average healthy human, 60% is the typical or standard ejection fraction. So 39% is not horrible, but it's not good either. They don't consider it severe, they don't consider it mild, it's in the moderate range. So that's kind of what we're dealing with. Next question is, what caused it? Well, it's genetic. And so they found it, well, I'll explain how they found it in a second, but so that means we also tested the other men in my family, so my dad and my brother, and neither one of them had it, so thank goodness for that. But yes, it is genetic. Was born with it, obviously, in the womb. My heart didn't form a smooth, firm muscle. It kind of stayed spongy. That's how it starts, and then as you grow in the womb, it becomes this firm, strong organ. And basically part of my heart didn't do that. So the next thing somebody asks is, will it affect the way that I live? And the answer to that is yes and no. So I do have some symptoms, and what those symptoms are is basically like I have a lot of PVCs, meaning extra beats, which everybody has extra beats, but there's a certain amount of them that are normal, and then a certain amount that are dangerous or a problem. And so I have one extra beat per every 10 beats. Actually, a little bit more than one, something like 11% extra beats. And so, I can actually feel them. I'm aware of them when it happens. I can tell, and it's a bit uncomfortable. So I've known this since I was maybe like 12. I remember having this uncomfortable feeling in my chest, but thinking that, well, this is normal, everybody has that. I didn't realize that something else was going on. So I'm actually really glad that they caught it when they did, because who knows what would have happened if we hadn't caught it at the time that we did. So what are the treatments for it? That's a good question. So I take carvedilol, 12.5 milligrams twice a day, and that's a beta blocker, basically tells my heart to work less hard. And then the other medication I take for it is lisinopril, and that's a common blood pressure medication. Between the two of those, it kind of mitigates some of the, say, damage that I would get. And over time, you're probably wondering, how do you get damage if your heart is spongy? Why do you end up with damage later? So your heart has to work extra hard whenever the muscle is shaped like a sponge, because wouldn't it be more ideal if you have this firm muscle to push liquid out of, rather than like a sponge trying to push liquid all in one direction? And so over time, that contraction of the spongy material, which is supposed to be firm, causes the myocardium, which is kind of the outside or the muscle layer, kind of surrounding the main chambers in your heart. It causes that to be weakened over time. So now that they have me on these two medications, that should slow the progression down, and my heart should become less weak. Will I need a heart transplant? So probably not. So that, and we say that now, that I'm not close to that. We don't anticipate that, anything like that. So probably not, but whenever they do my lung transplant, if I'm approved for that, then at that time they would consider whether or not my heart is unhealthy enough to also deem both heart and lung transplants. So like right now, the answer is no. And we anticipate the answer to be no whenever my lung transplant comes around. But we won't know for sure until that time comes. How did we find it? How did we find my heart disease? Because, you're probably thinking like, well, what if I have a heart disease? It's how would you know if your symptoms are not, if you don't have a heart attack, or if you don't have extreme chest pain or something like that, where you just have uncomfortableness, or you have some pressure every once in a while, or you are aware of your heartbeat. Things that I thought were normal until I realized, until they caught a heart disease by accident. So this is what happened. I was in the hospital. I was an inpatient, admitted, just for a pulmonary exacerbation. And during that time, I actually had this episode where I had extreme chest pain around where my heart is. And something just locked up. And I just couldn't move. I was laying in bed and I just couldn't move. And I was just I couldn't even bend my neck or anything. It was just extremely painful. And so they called like a rapid response. And it lasted for probably, between 7 and 10 minutes. It went away eventually, but that kind of led them to look or do some diagnostic testing. And so one of the things they did first was an EKG, and they saw a lot of extra beats, too many, that was considered abnormal. And so that led them to do an echocardiogram. And so they did the echocardiogram, and they saw what looked to be, abnormalities in my heart, in the left ventricle. And so that led them the next day to do a echocardiogram with a bubble study. I don't know how the bubble part works or what contribution that has to the overall test, but anyway, I know that was the progression. So they did the EKG, echocardiogram with bubble study, and then the next and final diagnostic tool they used was a cardiac MRI, and that took about an hour. Very, very loud. It's the thing you always see on TV. The patient's laying flat on the board, and they're in this tube-shaped thing. I guess there can be CTs as well, but MRI shaped very similarly. It's the thing where you can't have anything metal because it's a big magnet. And so they did that. That was the kind of the final, because the bubble study also showed the non-compaction, or what looked like non-compaction, or maybe hypertrophic cardiomyopathy or dilated cardiomyopathy. And those are two other diseases that can be misconstrued for non-compaction or confused with. So the MRI gave them a good look into what my heart chambers looked like, and so that's when they identified it. the first time. To really identify it, what they have to do is they have to have a repeat MRI at least 3 months from the first MRI. So I stopped the weightlifting, I stopped the caffeine, the stimulants, all of these things that I was doing for the 3 months. Didn't do any of it, just kind of rested. They said I could do cardio, so I was doing my 20 minutes of kind of like light to moderate cardio every day at the gym. And we repeated the MRI, and my left ventricular ejection fraction actually went from 43 down to 39% on the second MRI. So that confirmed it for sure, because they were expecting, like, if I stopped doing all the weightlifting and taking caffeine and things like that, that my ejection fraction would actually return back to, closer to the 60% range and be normal. Like if I had caused this on myself by my extreme weightlifting, by the years that I've done it, by pushing so hard. And so that basically proves that it was genetic versus like patient-induced cardiomyopathy. So so anyway, we found it. That's how we found it. I was an inpatient for a pulmonary exacerbation, had a cardiac incident, whatever it may be. It wasn't a heart attack. They really don't even know, because they didn't do the EKG until after the pain had ended, and so we really don't know what it was. Could have been a muscle spasm around the ribs that tightened up and locked up. Could have been some kind of like pulmonary pleura-related stuff with the pleura sac, or who knows what. But that's how they caught it. So super glad that they did, because now they have parameters for my weightlifting. Actually, yeah. So this takes me to the next thing, and probably the most important part of the video. I've had several recent cardiologist appointments, and I actually have 3 separate cardiologists, and they all kind of do their respective things within cardiology. And so the one I saw yesterday was a electrophysiologist, and what that individual does is they specialize in the electrical signals that the heart produces, because whenever you hear of a pacemaker, where your body already has like a natural pacemaker, and it's kind of these electrical waves that tell your heart when to contract and when to release. And so if people need a pacemaker put in, it's because your heart on its own wasn't doing it properly, or it was doing it too much. The pace was too high, pace was too low, pace was just incorrect, meaning like there was a cardiac excitation or some sort of premature contraction or release, things like that. And so this gentleman I saw yesterday was a doctor who specializes in that side, the electrical side. And so they gave me the option of getting a defibrillator placed. They say that I'm at great enough risk for a deadly arrhythmia or heart failure that it could be a good option to have a defibrillator placed. So they let us look at the defibrillators. They actually let us hold them. It would be something that would, they make a kind that's implanted under the skin, and then they make a kind that's kind of, well, I guess they're both implanted. So there were 2 kinds that we looked at, and the one that they recommended for me was, it was probably about this big, which is enormous, but it's like flat, kind of like a Thin Mint, maybe a little thicker than that. And that's mostly the battery. It's kind of shiny. Maybe I'll have an example that I'll show you all. And so the wires that come from that device go to the heart and attach to a couple different spots. And whenever my heart goes into a unsafe rhythm or an incorrect rhythm electrically, that device will take over and send shocks to my heart to either put my heart back into the correct rhythm or to bring me out of a code situation. So now we have to think about the risk versus benefit, and by we I mean Marlene and I have to think about the risk versus benefit to getting a defibrillator placed. Um, they kind of left it in our hands. Like it was their recommendation that like this would be a good. It's like wearing a seatbelt. You know, you don't anticipate getting in a car accident, but you are driving a car. Cars do crash sometimes. Statistically, there's a good chance that in your life you probably get in a wreck. And so for me, statistically, it would be um, in my best interest to have this extra, safety measure. Um, and so they left it up to us. So it's something we have to be thinking about and praying about. And the risks with it are the chance of infection, like just because they're implanting something foreign into the body. Um, that's the main one. Oh, when they do a lung transplant, the actual wires that will come from the device will kind of be seated under the skin in my rib cage, and then the wires will kind of come under the pec and go in right here. I think they'll have an insertion point around here, and then when they're doing the lung transplant, the incisions that they will cut to remove my lungs and replace them will be under each pec. And so they would have to cut through the wires, but they said to replace the wires is not an enormous deal. It's just like it's just kind of an added thing to a really long procedure in the first place, the transplant. And so it's just one other thing that we have to be aware of mostly. So those are the two main drawbacks, is just that risk of infection and then replacing those wires for a lung transplant. Another question that I asked was, because they talked about the chances of me going into a dangerous rhythm situation, meaning having an arrhythmia, so my heart rate slows down to say 10, or my heart rate goes up to 260, something like this. It's certainly a possibility that I could go into a dangerous rhythm. And so I asked, like, what are the things that I need to avoid? What things can stimulate that to happen in the first place? And so they told me a couple things. The first one he said was stressors. So if you're extremely stressed, the body's stressed, then your heart tends to react to that. Something with a hormone dump and the balance of things, and the adrenaline dump can cause an arrhythmia. So avoid stressors. The super heavy weightlifting. He said don't do any HIIT cardio, high intensity cardio. Let's see. I think I wrote down. Let's see. He didn't say caffeine, but I can only assume that caffeine, being a stimulant, would maybe contribute to that. So I am going to have to ask next time. But right now I'm going to go low on the lower side of caffeine, because I typically have, plenty in a day. So let me see what else I have written down for you all. Oh yeah, so recently, after not yesterday's appointment, but the cardiac appointment before that, which I think was last week, maybe the week before, they had me wear a Holter monitor, which is basically telemetry. So a little box that has wires that extend to each, I believe, 5 different spots on the chest, and it kind of measures your heart and looks for things that they might catch or might be worried about. And so I'm going to kind of read the results of what the doctor put after they observed my Holter monitor, and I wore that for 48 hours. So my left ventricle functional parameters, left ventricle ejection fraction was 39%. It says the right ventricle ejection fraction was 37%, and I don't know if normal for a healthy human is 60% or if it's something else. For the right ventricle, I just know for the left ventricle it's 60%. I had tachycardia, which is a heart rate that's too fast, or a heart rate that's, I believe the parameter is above 120 beats per minute. And so I had tachycardia for 114 beats per minute. I found that to be interesting, but it says the time associated with it was, I think like 9:30 p.m., which is typically when I'm at the gym, somewhere between 7 p.m. and 10 p.m. So could have easily been doing my cardio at that time. So I'm not surprised that I had tachycardia, so to speak, for that many beats in a row. Actually seems low, 114 beats. That's like what, a minute and a half, 2 minutes. And I had bradycardia, which is slow beat, which I believe is defined as heartbeat less than 50 beats per minute. I had bradycardia for 57 beats in a row, so a heart rate of, let's see, 55. So, yeah, so just barely, well, maybe it doesn't define, oh yeah, it does. It defines bradycardia as, I just found those interesting that I was both tachycardic and bradycardic. So transplant, I'll touch on that one more time. Whenever I'm going to be evaluated for lung transplant, meaning like the surgeon's team, the transplant team evaluates me, at that time they'll coordinate with my cardiology team, and they'll evaluate the whole picture. Basically, are my lungs ready? Will I be healthy enough for anesthesia? Is my body weight good? And is my heart good? So they want to know, they're going to coordinate with the cardiologist to see what their recommendations are, and they're going to have to work kind of as a big unit together to see if lung transplant will be an option. So we hope and pray that my heart isn't going to interfere with my transplant odds. So keep us in your thoughts and prayers. Let me know what you would do with the defibrillator decision. So we have to decide if I'm going to get a defibrillator. Let me know what you would do. Do you think you would get it? Do you think it's a safe choice given the risks? And let me know in the comments. Let me know that I'm on your prayer list. Let me know things like that. So, all right, that's the end. This was Temptation with the Final 10, signing out.